Shared decision making in the outpatient physical therapy arena is a lot different than shared decision making, let's say, in primary care, because let's face it, a lot of the options that we can provide from an intervention perspective all have very similar levels of risk, and that risk is probably very low. How do we make this work?
Well, hi, everybody. I'm Dr. Skip Gill, and I'm one of the trustees on the Foundation for OMPT. And today I have the pleasure to introduce our guest, Dr. Jason Beneciuk. Jason is a research associate professor at the Doctor of Physical Therapy program at the University of Florida, and also a clinical research scientist at Brooks Rehabilitation. He's been supported by the National Institutes of Health, the Patient-Centered Outcome Research Institute, the Center for Health Services Training and Research, and the Foundation for Physical Therapy Research. His research interests focus on musculoskeletal pain, psychologically informed physical therapy, implementation science, and health services research. He currently teaches evidence-based practice in the Doctor of Physical Therapy program at the University of Florida. He also serves as an associate editor for physical therapy and an editorial review board member for the Journal of Orthopedic and Sports Physical Therapy. Dr. Beneciuk was also the recipient of the Eugene Michaels New Investigator Award by the American Physical Therapy Association in 2021. Jason, welcome, and it's great to have you on the show.
Hi, Skip, and thanks for the opportunity. I always enjoy these podcasts, so looking forward to it.
Okay, awesome. Well, you're very well known in this area of mechanistic research amongst other endeavors. But I wanted to hear a little bit about what your clinical and your research pathway was that led you to develop your expertise in this area. What was it that sort of sparked your interest?
Yeah, I'm always kind of surprised when people say that I'm quote unquote known in the area of mechanistic research for manual therapy. But I guess that's where it kind of all started, right? And I think the group that I worked with at the University of Florida during my PhD training, we did some pretty I guess novel, innovative studies back then. So that's where I think it probably all started. And my interest in mechanisms of manual therapy specifically, I think really stemmed back to my clinical practice. And then obviously as I kind of transitioned back into a fellowship program, that's really where, I started having questions about, we're seeing good outcomes with some of these patients. We're seeing so-so outcomes with other patients. What are the potential mechanisms why some people do better than others and vice versa? So I think that's really where it all started. And, if you go back to my PhD training, my first project really focused on manual therapy mechanisms, where we looked at mechanisms associated with neuromobilization techniques. So, we used different assessment tools like quantitative sensory testing and to kind of, fill in some of the gaps for one specific type of manual therapy technique. I think one thing that was, I think, kind of an important transition in my journey along the way was the shift that happened in my research direction. And, I think going back to even when I said I wanted to do a PhD, and I think everybody probably goes through this before they get started, like they already think they know what their dissertation project's going to involve. And I honestly always thought my dissertation project would focus on slump stretching, I'm sorry, because that was like a real interest of mine in clinical practice. And that shift in research really happened probably after the first 2 years. And at first I was a little worried, but I think ultimately in the end, it was a really good decision that my mentor kind of put on the table for me to think about. And, now a lot of my work is really focusing on contextual factors, which could, and we might get into this discussion in a little bit, could be mechanisms in of themselves. So long-winded answer, but I think an important question.
Yeah, thank you. So I wanted to talk about some of your ongoing research. So you received the Clinical Science and Manual Therapy Grant Award in 2023. And that's a new grant that's offered by the Paris Family Foundation through our foundation, the Foundation for OMPT. I wonder if you could give us a little overview of maybe the study's aims and the gaps you were looking to fill with this ongoing study.
Sure. Yeah. So the the title of the study is "Patient and Physical Therapist Perspectives on Spinal Manipulative Therapy for Low Back Pain and Associated Clinical Outcomes." Long title, but most of our studies do have fairly long titles. We also included in the title that this is a single arm intervention study, which is important, and I think we'll kind of maybe take a little deeper dive into kind of the limitations of such a design. But I think the precedence for this study really, when we kind of talked about even developing a grant for this mechanism, is that we're obviously, we know as practitioners, as clinicians, our clinical partners that we talk to, we know that the responses to spinal manipulative therapy are really influenced by a multitude of interactions between the
Mhm.
patient and the provider, um, particularly related to these contextual factors. But it's not that easy. Those contextual factors could be specific to the patient, they could be specific to the provider, in this case, the physical therapist, or really the interaction between the patient and the provider's relationship. So that's what really kind of, I think, you know, that was really our main interest in kind of going for this type of mechanism. And we also we used our prior model. So I think in the manual therapy world, most folks refer to this as the Biolosky Model, mechanisms of manual therapy. And we first published that in, I think, 2009, and we had an updated model in 2018. And that model was really important for us in terms of developing the idea for this study. So we can talk about that a little bit more too, if that's of interest. But overall, the goal is to really gain a deeper understanding about contextual factors associated with manual therapy utilization, the perception from both the provider and the patient perspectives, and then the clinical outcomes associated with patients after that experience with manual therapy, spinal manipulation specifically.
Sure. I mean, it would be great if you wanted to give us just a quick overview of the model, and then I was just thinking if was there anything maybe within this study in terms of either the methodology or the design that was unique, allowing you to get at questions maybe you weren't able to answer before.
Yeah, so I think the one thing that we're really excited about is that the conceptual model for this project, like I mentioned earlier, is
Hmm.
based on our mechanistic model,
Yeah.
and that model really describes potential mediators of manual therapy related pain inhibition. And if you refer back to the most recent edition of the model back in 2018, it's a little different than the initial model in that we are really focusing on just one component of the model. And that's really, if you refer to the paper, it would be considered zone one. And that would be contextual factors related to both the patient and the provider. And one of the things that we really tried to incorporate in the design of this study is to collect data specific to the patient and specific to the provider, but specifically using measures that were very similar. So that in essence, it gives us the potential opportunity to really compare a provider's perspective about, let's say, expectations and beliefs to a patient's perspectives about pain beliefs and expectations as well, and also linking that specific provider to that specific patient as opposed to looking at it on more of a group level, if you will.
Oh yeah,
So,
I
you
like
know,
that.
I think very, very, very complex in terms of how we're going to collect this and match up patients with specific providers. And I will tell you up front, it took a lot of time to kind of set up the data collection system with this, but we're beyond that now, and that was a nice exercise in really making this work. So I think that's something that we're probably most excited about.
Yeah, and I know you're kind of in the midst of it, so it would be kind of too early to probably talk about results. But in terms of kind of your recruiting and your data collection, can you give us an idea of maybe where you're at, and then maybe what the timeline looks for finishing up this project?
Sure. So at this point in late February 2025, we have 12 physical therapists enrolled. We also wanted to, we were intentional in that the physical therapists that we approached for this study, we wanted to have a fairly equal distribution amongst those who have received or experienced or went through a manual therapy fellowship program, and another group that haven't, because that potential experience could influence the outcomes, and it could influence a lot of the outcomes that we're looking for in this study particularly. So we have, like I said, 12 physical therapists involved. The goal, the plan, the expectations, if you will, is that each of those physical therapists recruit and enroll 8 patients over the course of the study. And
Mhm.
right now, I think we have approximately 8 patients that are enrolled across the 12 different physical therapists. So that's where we are right now, and I think it's too early to kind of do any preliminary analysis of anything. But that's really our main effort right now, is to really focus on the recruitment and enrollment parts of the study.
Yeah, that's great. And I mean, I like that you're looking at both angles of this. Do you, either from your own kind of research or clinical intuition, or from other things maybe that are published, do you have a sense of, by parsing out maybe how much of this is, how much of the effect might be related to the patient's contextual factors versus how much might be related to the clinician? I mean, are you thinking it might be a 50-50, or do you think that maybe even like the provider's influence might be a lot higher than we thought?
Yeah, so that's another great question, and that's something we considered when we kind of developed this grant. If you look at the literature in this area, there's been quite a few studies that really focus on one or the other, right? The patient's perspective or the clinician's slash provider's perspective. And there's
Mhm.
been a few studies that have actually looked at both and really looked at relationships amongst patients and providers. Um, so that's kind of like our approach to this, is that we wanted to look at both, but we also wanted to link specific patients with therapists, not as a therapist group as a whole. The question about, what's my hypothesis? What do I think is stronger? I think, in a perfect world, you might say that it's 50-50, but I don't think that will be the case. um, I think my gut instinct is probably telling me that a lot of this is probably more heavily driven by the provider. And again, I think, a follow up question to this study would be, wouldn't it be great if we had a better understanding of the influence of provider perspectives and how that can influence outcomes? And I had a really interesting talk with some of the leadership in our health system, just to kind of get an idea, like, in a few years from now, would this be something that we would even consider? And the topic of really matching patients with providers that have similar attitudes, beliefs, what have you, about, in this case, spinal manipulation. And, I've talked to others about that, and, well, that sounds like a great idea, but, that's not going to happen. Leadership in my system said that would be great if we can do that. And are we there? Are we to the position that we can do that right now? No, but just to hear that there's enthusiasm and interest and excitement from leadership on our system, that, this is maybe something we could look at in the future. To me, that was exciting, and that really kind of pushed me a little further to say, hey, this study, the outcomes of this study could have relevance from a clinical practice perspective as well.
Yeah, yeah, definitely. I mean, I think that's great. I mean, maybe any other future research directions that you're thinking along these lines? I mean, I know like in this area, only everyone can take a small bite out of the bigger problem. So whether for your research team or other teams that are out there, any other maybe big ideas or big questions that everyone needs to dissect a bit?
Yeah, so one of the co-principal investigators on this study is Dr. Joe Biolosky. He's one of my colleagues at the University of Florida and Brooks
Mhm.
Rehabilitation, and we both have a really shared interest in shared decision making. We recently completed a small pilot study looking at, how we can incorporate or integrate clinical practice guidelines into clinical practice with our patients, because our patient partners tell us although they may be aware of the guidelines, one of the real struggles or barriers is still how to implement them in clinical practice. So one of the things that we kind of looked at and we were interested in is, this could be an opportunity for shared decision making. And I say that because, shared decision making in the outpatient physical therapy arena is a lot different than shared decision making, let's say, in primary care, because let's face it, a lot of the options that we can provide from an intervention perspective all have very similar levels of risk. And that risk is probably very low,
Mhm.
right? So how do we make this work? So that's one thing that we are interested in is kind of, how do we really take the preliminary results of that small pilot study and kind of what we're looking at here and maybe look a little further in terms of how we can really integrate our patient preferences and our clinicians' experience in terms of clinical decision making for our patients.
Yeah, I like that direction. And lots of work needs to be done, I guess, by lots of folks on that.
Yeah,
Um, I wonder if you could just share for me a little bit about, for folks maybe looking for the clinical science and manual therapy grant. We're in the process right now of that, and this is an award that we'll be doing every year. Um, and at least for the next couple of years. So I just wonder if you had any advice or maybe just if you could share a few thoughts about the process of going through that particular grant application with our organization.
sure. Yeah, and I'd like to thank the Paris Family Foundation for the opportunity. It was very timely for our group to kind of move forward with this, and I think the process in general was, dare I say, it was a fairly easy process for us to kind of communicating with folks along the way was a seamless process. So that's the first thing I wanted to talk about. I think in terms of suggestions is, and I think this probably applies for a lot of different grant opportunities, grant mechanisms, is make sure your project, idea is consistent with the overall mission and goals of the grant application. Um, you know, because even if investigators have ideas about a novel idea, an innovative idea, an interesting idea, it needs to be in line and consistent with the call for the grant itself. I think another thing that's really important is to really develop your team, a strong team ahead of time. And a really important part of that team, at least in our experiences, is the clinical partners. We've communicated with and we engaged our clinical partners even during the grant development stages to really get their perspective about this idea and how might this look in clinical practice. Conduct of the study in clinical practice, because that's where this study is being conducted. It's not a laboratory setting. This is really being done during routine clinical practice. So I think those are probably the most important points and comments in terms of advice for folks that might be thinking about this in the future.
Yeah. Okay. Yeah. Thank you. So just wondering as we kind of finish up, if you have any kind of last thoughts or any little pieces of wisdom maybe you'd like to share with our listeners about, building a successful academic and research career like you've done.
Yeah. So a few years ago, back in Cleveland at the AAOMPT annual conference, I was asked to give a talk on mentorship, right? For the first time in probably 15 years, it really forced me to sit down and think about my mentors. They're always on your mind. You know who they are, but to really talk about the influence of the mentors. So I think that's really really important is for folks to identify strong personal and career mentors, and do it early. And sometimes a single individual could kind of fill both of those, right? Personal mentor and a career mentor. I think that's really important. I think developing your strong collaborator team, and when I say collaborator team, I think it's important that folks think about real long-term collaborators and not just collaborators that want to be involved from a data collection perspective. The
Sure.
sooner you can develop and strengthen your team, I think it'll be a benefit to folks. I mentioned earlier about the collaboration with clinical partners. I think that's extremely important. And then the final piece of this, we did a little work several years ago in kind of developing partnerships with our patients. And that's a little bit more challenging. It's a little bit more difficult, especially sustaining those partnerships. But I think it was really valuable to me, and it allowed us to kind of provide the patient's perspective in terms of ideas that we have for our future research projects. So I think those are probably the easiest things to think about in terms of my mind. And then finally, reality, it's not an easy journey. There will be times where you decide you want to switch your career or position again, maybe some folks, but I think you have to kind of keep the end picture in mind, and it's very rewarding, especially if your overarching goal is to improve clinical practice. Ultimately, it's going to benefit the patients that we serve, and I think something that can't be missed is it's also going to benefit the providers that care for those patients. So, I think those are my pieces of wisdom, if you will.
I think that's great. I've enjoyed this time with you, Jason. Thank you so much for taking some time out to talk to us about your current study, about the grant process, and just kind of future research directions and some great advice there. So we'll be looking forward to hearing more about your study and any future research endeavors. So again, thank you and take care, Jason.
Okay, thank you, Skip.